Since the first case of the coronavirus was confirmed in the Gambia on March 17, President Adama Barrow makes 6 state of emergency declarations which affected economic activities, but it did not prevent the surge in COVID-19 cases. One of the country's leading opposition parties, the UDP, is blaming the government for the lack of an effective strategy for the fight against the virus. Here's more details of that in this report.
The Gambia opposition leader Ousainou Darboe said the government of Adama Barrow has failed on its fundamental duties to help the citizens confront the deadly coronavirus pandemic. Darboe, who is the Secretary General of United Democratic Party, said the government wasted money on measures that weakened the health sector's strength to contain the virus when he spoke at UDP's 24th anniversary on Sunday.
At the leadership and strategic level, the government has failed miserably to plan and execute an effective and comprehensive approach to this deadly disease. It wasted time and resources on bureaucratic half measures that has taken much needed resources from hospitals, patients, equipment, and frontline workers.
Last week, the Gambia government said it was converting a major hospital which receives hundreds of people daily into a COVID-19 center. The decision to make the Serekunda General Hospital in Kanifing a COVID-19 treatment center was due to a rapid rise in confirmed cases and deaths, according to the government. However, Darboe, who is the country's former vice president, said this was a bad decision. He said the government should have used ex-President Yahya Jammeh's air-conditioned tent instead.
The recently announced decision of designating the Serekunda Hospital as an exclusive COVID-19 treatment center risks jeopardizing access to health care for a large number of patients that rely on this facility for the treatment of non-COVID illnesses at a time when our already overstretched health facilities have difficulties coping with their existing patient loads. The net result would be denial of easy access to medical care for treatment of other illnesses. A better alternative would be to release to the Minister of Health the big air-conditioned tents that Yahya Jammeh purchased from funds currently sitting on State House grounds and position them at suitable locations, properly equipped to be used as a treatment center for COVID-19 patients. It can accommodate a large number of patients and their caregivers with some augmentation of materials and other resources.
Madi Sise, the National Assembly member for Serekunda West, also an opposition figure, agreed. Honorable Sise, a UDP member, said converting the Serekunda Hospital into a COVID-19 treatment center was never a wise decision.
I do not welcome that idea because the Serekunda Hospital is a major hospital in the region, in the country, and there are a lot of patients there. So turning that to a treatment center would be it's difficult because you cannot, what are you going to do with the patients that are there? So for me, my take on that is I do not welcome it. I think what the government should have done was to create special treatment centers because there are enough money that has come into this country to fight COVID. So if government is not able to create a special center, then they are not serious with what they are doing with our funds. They don't have no justification to turn that to a COVID treatment center. There are enough funds to create one, special.
Meanwhile, as COVID-19 cases continue to rise, the Gambia government is seeking to learn from neighboring Senegal for a better response to the pandemic. Reporting for iAfrica TV, I am Ibrahima Kebi Sonko.
One of the country's leading opposition parties there, the UDP, blaming the government's response in the fight against the COVID-19 pandemic.